The Prime Minister is touting a report on the government's $30 million Healthy Homes initiative that shows it has helped 142,000 people live in warm, dry homes. The report found the scheme, which gives low-income families insulation, heaters, curtains, bedding and other minor repairs to make houses warmer, has made a tangible impact on families. The initiative covers 11 regions in the North Island and will be expanded to cover the whole country by the end of the year. Wayne Knox no Waikato Tainui is the General Manager of Māori Housing Advocacy Group, Te Matapihi, and he's with us now. Kia ora, Wayne, thanks for joining us.
Tēnā koe Neil.
Now, Housing Minister Megan Woods says the government is on track to fix the housing crisis. Is this consistent with what you're seeing?
Yeah, well, I think on track, can mean a number of things. And, one thing's clear is that the housing crisis is not going to be resolved in the term of one government. It's actually going to take multiple terms of government. It's actually going to need to span multiple governments. So it's really a long-term solution that's needed, which is going to require consistent investment from government and ongoing innovation. But what we are seeing is a lot of the right ingredients that need to be there. We've got a significant investment in public housing and in state housing. We've also got significant investment in Māori housing, which is fantastic. It's the most significant investment for decades, and it really, the key is we need to stay on course, and that's going to be the challenge, I think.
Now, you'll be very aware of this, but for the past couple of years, we've been told our housing market is a human rights crisis. Do you see things improving or declining?
It's a little bit hard to say at the moment, having just come out of the whole lockdown experience. And, our observation throughout, the various lockdowns that we've had has been that not only has it exacerbated the existing issues, but it's put a spotlight on them. And so it's really exposed underlying issues that have been there for years anyway. At the moment, we're still seeing some of the impacts from COVID. Obviously in terms of employment and so on, and those are likely to remain for a little while yet. What we're still seeing is high demand for supported housing services, high demand for social housing, for public housing. If anything, it's still on the increase at the moment. Still seeing very, severe cases of housing deprivation and everything that goes with that. And of course, it's all been drawn into the spotlight again with, the emergency housing situation. So I think we're at a turning point, hopefully, but I don't think we're there yet to say that things are turning.
Wayne, the Prime Minister says the Healthy Homes initiative has made good progress in state houses. Is good progress enough? Are we on track to help whānau do better, or is there still obviously a lot more that needs to be done?
Yeah, well, looking at the report, probably there was over 20,000 whānau within state housing that received assistance through the Healthy Homes initiative, which is great. But one thing that points to is that obviously a lot of our state homes are needing a bit of work, and we're seeing some major work program underway with Kainga Ora. I think Kainga Ora has a way to go in terms of providing what from a Māori perspective we would call a healthy home. We need to think holistically in terms of not just the warmth and the other aspects that are covered by the Healthy Homes initiative, but also things like access to employment, access to transportation, whether homes are actually meeting our cultural needs as well, whether they're providing for intergenerational living and so on. So I think we always need to keep pushing the boundaries. But, again, as you say, Neil, there's a lot yet to be done.
Now, we all know that the Healthy Homes Initiative was part of a policy to lower the number of tamariki with rheumatic fever, which is tied into damp, cold housing. Will good quality housing equate to good health outcomes for whānau, in your opinion?
I think it's definitely a part of the equation. There's a lot of research that, particularly around rheumatic fever and so on, that show that, it has if you're unfortunate enough to contract rheumatic fever, it can have lifelong implications for you. So I think it's great to see the initiative and the success it's having. But I also think that, again, we need to take a more holistic approach, because the health is one of the areas, areas within government that I think need to play a more coordinated role alongside other agencies such as Kāinga Ora and the Ministry of Housing and Urban Development. For example, those whānau who are experiencing homelessness have more often than not high and complex health needs. They need mental health support, they need addiction support, and what Māori providers are finding is that sometimes there are quite significant challenges in receiving that support in a coordinated way with agencies.
Yeah, wonderfully put. Housing is a big part, but a part of a bigger picture. Wayne Knox, General Manager of Māori Housing Advocacy Group Te Matapihi, thank you so much for joining us today. Ngā mihi.
Kia ora, Neil. Ka kite.